Hello, everyone, and welcome to Ask Clinical. Today, again, another favorite, a newer device. We're introducing Ask Clinical, the Pico edition. And my name is Sandra Woods. I'm the clinical director. And I'll start off by just letting everyone know that when Pico arrived on the scene, I felt it was the answer to everyone's question when they come in during a consultation. Are you comfortable treating skin of color? So finally, we have a device that we can use comfortably with skin of color. That's my favorite reason. I'd like to introduce you to Tammy Haddad. She's our special guest. Tammy is a nurse. Tammy and I have known each other for over 15 years. She has an extensive background in nursing, but she's our special guest because she's actually our our salesperson, visiting clinical and helping us demonstrate the Pico, which she has at her home. Tammy, could you let me know how you felt when Pico came to Luminous and when we started rolling this out to our customers?
Well, I have to say that there's so many reasons why my customers love the PiQo4 and have chosen the PiQo4. Most importantly, I think it's one of the most versatile systems out there, allowing to treat all skin of color, as Sandra referred to, but also the ability to treat advanced pigment in any way, including tattoo removal, as well as doing skin rejuvenation. And these treatments are relatively comfortable for the patient and result in great results.
Thank you, Tammy. I totally agree with you. We also have our clinical trainers, Linda Boo. She resides in Dallas, Texas. She's been an esthetician for 15 years with a concentration in dermatology. Linda, her favorite device from Luminous is IPL and CO2, and she also loves skincare. But I know, Linda, that you've taken a special, feeling about Pico also, and that you really like it. You've had a background in tattoo removal. Can you tell me why you like our Pico device?
I love it because of the comment that you've made. So, but also for someone that suffers from melasma, it has been just a great treatment for skin of color, like you said, Sandra.
Oh my goodness, I agree. Melasma is huge. And that reminds me, I want to tell all of our customers that are joining us on this webinar that we have attached a special ebook on the treatment of melasma in pregnancy. We've also, so that's a little treat for everyone. They can download that ebook. We also have another one-page brochure on the Pico that you can also download. So thank you, Linda. I'd like to introduce Latoya Boyd. Latoya is another one of our Luminous clinical trainers. Latoya resides in Apple Valley, Minnesota. She's been an esthetician for 5 years. She enjoys, her favorite devices are the New Air, the Splendor, and Latoya loves teaching. So Latoya, can you just shed some light on what you think about Pico and how you felt about it when it came to Luminous?
Hi, Sandra. Hi, audience. I really love the Pico. I was really excited when we launched the Pico because most practices found that they were seeing a lot of ghosting from their tattoo removal devices. And the fact that our Pico comes in both nanosecond and picosecond, it allowed you to really get rid of that residual ink, also giving you a very large spot size. So I was really excited to see when we had customers that had ghosted tattoos come in for a follow-up visit for a Pico treatment, how it was able to really get rid of that residual ink.
Latoya, that's an excellent point that you make. And we also can credit not only that we have the Pico and Nano technology, that we have a deeper reach because of the size of our hand pieces. And as we know, if we increase our spot size, we increase our depth of penetration. I'd like to tell the audience that if they scroll down to the bottom, they can start asking questions, asking clinical questions, and I will be able to view them and talk to our clinical trainers. So Tammy, while we're waiting for questions to kind of bubble up, can you just give us an idea of the actual Pico, the software, and what we look, what the screen looks like? And if you could just give us a little quick tour of it, that would be great. Thank you.
Okay, super. I can do that. So I'm going to go over to the system now. And basically, what's so nice about the system is that it's very user-friendly. So one of the first things you do when you turn it on is you decide which handpiece you're going to use. Most of the time when we're doing basic treatments for pigment or tattoo removal, we'll use the handpiece that is the zoom handpiece. What's really nice, you can dial in the specific spot size all the way from 3 millimeters up to 15 millimeters. And as LaToya said, it really creates larger spot sizes, which allows us to go deeper into the tissue with less energy. And what does that do for our patients? It causes less discomfort, but more importantly, less epidermal disruption, and we still get really good efficacious treatments. So once you've decided which handpiece you're going to choose, you basically then choose your wavelength. Once you've chosen your wavelength, you can choose one of the 4 pulse durations. Most of the time when we're initially treating patients, we'll start with the nanosecond to treat first-time tattoos or sometimes first-time pigments. It allows you to treat those bigger particles, like we say, start with the boulders and then go to rocks and then go to pebbles and then go to sand. So you can basically start with the 8 nanosecond pulse duration. And at that point, you're going to calibrate the system. We're not going to go through that right now, but basically this is the screen and how easy it is to use. And then one of the other things I want to point out is that we do have really good treatment guidelines. And in these treatment guidelines, it gives you step-by-step instructions on how to perform all the applications. This was just put out in December of 19. And you can get this also on our portal. You can download from the portal. Does that help out?
It really does. Thank you, Tammy. That was perfect. So we do have a question from the audience, and the question is, for how many treatments do we need to have for treating melasma with the Pico? Linda, can I ask that question of you?
Sure. So it really depends on the melasma and what you're going to be treating and how you treat it prior to the Pico as well. So we know that anytime we're dealing with melasma, we want to make sure that we're pre-treating the skin with a tyrosinase inhibitor, some brightening serum, sunblock, things like that, prior to using our any kind of device. So with this Pico device, it's going to be excellent because you're going to be able to use both your nanosecond and picosecond to try to disrupt some of those melanocytes in the melasma there. So great. And, everyone will be different depending on, the type of melasma that they have. But I would definitely say start with anywhere between 6 to, plus treatments, just depending on how well they're doing. You can do every 2 to 4 weeks, or even 4 to 6, depending on the skin type as well. And then just make sure that you, continue and maintain with their brightening serums, and, really coach them through and manage that expectation, because I think that melasma is something that we constantly just try to treat and get rid of, but it is unfortunate that it is maintenance more than anything.
Thank you, Linda. That was excellent. And LaToya, could you add in what else we would do for skin of color before we start doing a full treatment on someone who is a Fitzpatrick 4, 5, or 6?
Yes. So the best rule of thumb is to always, of course, do a test spot. And I always like to wait an extra day. So I always wait 72 hours to make sure that my client doesn't have any adverse reaction. And to Linda's point, is always to pre-treat. Put your patients on a tyrosinase inhibitor or a melanin suppressant, no matter what Fitzpatrick they are, but primarily for my patients who are skin of color. The other thing that I always focus on too is their natural daily activities. Sometimes I have patients that, work out on the highway and maybe they have more sun exposure or things of that nature. So I always look for what your patients do for work as well. if you are treating your patients for melasma?
Well, that's an excellent pearl. You know, dig into that history, find out what they're doing, how much time they're driving, how much UV light exposure they have. Thank you, LaToya. And that really answers the other question, does it worsen melasma? And I think the answer to that question is, you know, if you dig into the history, do your test spot, you'll know if that melasma, after 72 hours, if you're going to see something that is a little more adverse. I'd like to shout out before I go on to my next question. We have on Partner Zone through Luminous, we have something called a treatment guideline that one of our clinical colleagues, Faxon Hatchett, actually helped put together along with Dr. Bichkowski, Dr. Friedman, Dr. Edward Zimmerman, and Dr. David Goldberg. I really, really urge everyone to go in and download the most recent treatment guideline that Faxon put together. He also put a lot of his personal pictures from his tattoo studio in there. And so big shout out to our clinical team member that is not with us today. So the next question, in regards to intimate lightning. Oh, this is an interesting question, but very pertinent to what's going on in some of our med spas. So, for example, lightening areas around the perianal. Would you suggest doing any Pico for that? Linda, could you answer that question? And then I'll follow it up with my answer.
Yes, so I definitely get a lot of questions on that when we are training with this. It is definitely a treatment that you can do. I also follow it up with some kind of melanin suppressant and also a tyrosinase inhibitor because that's also going to help speed up the process as well. So it is a great procedure to do that and get great results.
And I agree. I would like to say, full disclosure, it's not in our Luminous protocol. So we will not have settings for that, but as long as I a test spot before. So this is something peer-to-peer, what people will probably talk offline or talk to the experts about when you come to our laser elevations. This is a great question for a lot of our expert physicians. So thank you, Linda, for that. Let me see, I have another question. How many treatments before seeing a difference in melasma? So LaToya, can you take that question? How many treatments before we can see a difference in melasma?
So I noticed that I see a difference probably by my second or third treatment. But again, it really depends on your patient and their lifestyle habits to make sure that they're using their SPF or that they're not in the kitchen cooking where they're around that stove or that heat that's exacerbating that melasma. But normally for me, about the third session is when I notice a difference with the melasma and it breaking up. When you're treating melasma, because normally we say about 4 to 6 weeks is normally when you see it. So I think the other thing is you really want to pay attention to how closely you're treating your patients from their first treatment to their second treatment.
Thank you, LaToya. Linda, do you have anything else to add for that question?
I agree with what LaToya said, definitely seeing the intervals, but I also see improvement with your patients that have been pre-treated a little bit sooner. So if they have done like their chemical peels and their brightening serums and things like that, you sometimes will see the results a lot faster than somebody that you're just trying to just do like their bleaching creams and Pico. So I always try to either combine it or pre-treat them prior to doing these treatments.
Thank you, Linda. And I have another question about how do I get the treatment guidelines on Partner Zone. If you are unsure how to access Partner Zone, could you please call 1-877-LUMINOUS, L-U-M-E-N-I-S, 1-877-LUMINOUS, and ask to be connected to Partner Zone or to get access to Partner Zone. You would probably need the name of your office and a serial number to one of your devices. and they will grant you access to Partner Zone. And then you can download the Pico treatment guideline. It's December 2019, so it's been updated. Okay, so I have a question, and it's going back to Tammy. Tammy, can you just show us, actually, we'll all kind of, I know that the Pico is on in your home, and it might be a little loud, but can you show us how to attach a handpiece and calibrate a handpiece?
Which handpiece would you like for me to calibrate?
I think my favorite, the 1064.
Okay, so what we're going to do now is I'm going to show you that you have a zoom handpiece. This is the one that I'm going to attach to the arm and the one I'm going to calibrate. So at this point, just to go back to start at square one, I'm going to go ahead and attach this now to the arm, to the articulated arm. So you simply screw on the handpiece that you're wanting to attach. And now I'm going to go to the screen here, and I'm going to choose the zoom 3 to 15. Press OK. I'm going to choose the 1064 wavelength, and I'm going to choose the 8 nanoseconds like I did before. And now it's going to ask me to calibrate it. And so on the handpiece itself, you simply dial the 1064 to the 9 millimeters. And now I'm going to enter it into the calibration port. And when you enter it in, you basically put it into the port. And you know when it's in the port accurately when you're able to press the ready key. Having a little difficulty getting it into the port. Okay. Once you get it into the port, now it's going to give you instructions right on the screen. All you have to do is press and hold the foot switch. Oh, at this point, before I do that, almost forgot. So just to be on the safe side, you always want to put your eyewear on. And these are safety goggles that are for 1064 and 532 wavelength. So now I'm going to verify 9 millimeter again. Okay, and now I'm going to press my pedal while it's calibrating, and then release the foot switch. And now I have calibrated the device, and now I have the ability to set up the pulse rate. So I want to do maybe 5 pulses per second. I want to set my spot size at 15, and now I would set my fluence according to whatever treatment that I want to treat. And now, on your handpiece, you basically have to attach your tip. You can use the reusable tip or the plastic, whichever one meets your needs. And now I would dial my handpiece into my 15 millimeter spot size, which is the largest, and I'm ready to go.
Tammy, you're awesome. I love the goggles. Thank you for thinking about safety. It's so important. So really appreciate you.
Safety always comes first.
Yes, it does. So I have a question from the audience, and let me direct it to Linda. Linda, can you talk about the carbon facial?
Hi. Yes. So one of my favorite treatments with the Pico is the carbon facial. And so you start with the reason why you want to do the carbon facial, first of all, is to help shrink wrap your pores, helps with oil production, uneven skin. This is pretty much a treatment that you can do with pretty much anybody, and you can combine it with other treatments as well. So I do like the carbon facial. We use something called carbon lotion. It looks like this. It is black. I don't know if you can see it. Kind of here. We order ours through Focus Medical, and so we use this. One pump for the entire face is enough, and so you're just going to put one pump on your skin. I'm sorry, on your gloves. I usually double glove, so that way I can take one off, and then I'll just kind of roll it and pat it into their skin, and then I will do my treatment for them. I do need a smoke evacuator when I'm doing the carbon facial, just because there's a lot of plume that goes on with it. And then also you want to make sure that you do you set your parameters on there. We do have some settings in that treatment parameter guidelines, and I think Tammy's going to kind of walk us through some of those as well. But so you'll put on just a thin layer of it, and you'll do your treatment. And I usually it recommends for one pass, and sometimes I see some of the practitioners will do that second pass in order to pick up that residual carbon that's left over on the skin. But fantastic procedure, especially for those larger pores that people want to get rid of.
Thank you, Linda. Are you noticing, Linda, when you go out training, are you seeing more practices do the carbon facial? Is this becoming more and more popular?
Yes, it's very, very popular. I think a lot of people in Hollywood, and then you'll see it all over Instagram and some of the social media out there. But yes, very popular. And like I said, it's great for all skin types. It's great for all over complexion. It just gives you that natural glow into your skin, and you see improvement immediately after that treatment.
Thank you, Linda. And I'm going back, another popular topic today is melasma, and I get it, especially when we're all out walking and trying to exercise during our stay in place. Melasma this time of year is a big concern for people that have had it. Latoya, I want to defer back to you because, as you know, Luminous, we have so many different devices. Can you think of any other devices that you can use along with the Pico, maybe after they're finished with their sessions of Pico? What else can we use on patients that are suffering from melasma? What else is in our arsenal?
So we do have our Geneo that I personally love to use, because you do have the option of using your Neo Bright, which is, to your point earlier, Linda, talking about a tyrosinase inhibitor or anything that has any lightening agents. So I really love using that Geneo in between my sessions with my Pico to keep my client coming back in. We also have our Q switch on our M22. That is another amazing tool to also use in conjunction with your Pico, just to kind of give your patient a little bit of versatility if you feel like you're not seeing that pigment really break up. So I really like using both my Q switch and my Geneo, but a lot of times also, which a lot of patients aren't aware, that they even have melasma. Have any tool in your practice that kind of helps see any pigment or sun damage. I always like to do that during a consultation, because now you have gained a new client to bring in for a melasma treatment. So being able to really assess that and kind of show them where that pigment is during their treatment really helps them, so that when they apply their topicals, they know where to really focus in regards to making sure that they apply their melanin suppressants.
Wow, Latoya, that was a great pearl. And we don't, full disclosure, we don't have any ties to this company, but just from us being in practice, the Visia, the Reveal Imager, which is a smaller mini Visia, will help identify where that pigment is. I know, Linda, I'm sure coming from a derm practice, when you've had patients, dermatology patients, they've actually done biopsies to find out where that pigment resides. So it's a very frustrating problem to have, and now we have more tools to deal with it. So we do have a tattoo question, and I'm going to direct it towards Linda. It's the question is that they have great results with the removal, but then towards the end of a series of treatments, they still see a very light shadow. And we're familiar with that because actually with the Pico, that's one of our claims to fame, is that we're we're getting rid of that ghosting tattoo. But Linda, can you address what would you do to kind of attack that little bit of a shadow that you see after you're done with a series of treatments? What are some possible remedies?
Yeah, so sometimes it could be that your pigment is too big and you're not able to break it up. So sometimes I will go back to a bigger spot size, even a nanosecond, to try to break up the residual of that pigment, get it to, to go away a little bit more. So sometimes we kind of keep moving it with our pulse widths, and we go from a nanosecond into a picosecond. But then if you still have some of those little fragments in there, you got to continue to break it back down. So you might have to go back to a nanosecond and then continue to break it up a lot. So that's the beauty with the Pico, is that you have those options, the nanosecond and the picosecond there.
Oh, that's really nice. And I can go to that slide again, kind of showing the different techniques of breaking up the rocks into sand and the different stages that we go through with the nano and the picosecond technology. And also, Latoya, talk to us a little bit about doing spots or pigmented spots on hands. I'd also like to push a slide to show everybody some pictures of lentigines. Can you talk to us about that?
Yes, of course. So the biggest thing is making sure that you use the correct spot size. As Tammy stated earlier, you do have two different options in regards to your zoom handpiece. So you have one option that goes up to your 15 millimeter spot size. And then you also have a second zoom handpiece as well. So making sure that you use the correct spot size when treating your pigmented lesion is very important. You also have a plastic template that you can put on to the end of your standoff to make sure that you only treat over that pigmented lesion, because we want to keep the healthy tissue intact. So the fact that we give you multiple options of different templates, I always recommend that we use those when treating pigmented lesions.
Thank you, Latoya. Tammy, I have a sales question for you. I know this is Ask Clinical, but I can't resist asking you. So a customer is asking, it's a customer that actually owns a different device, but they're saying, how do I know if I should get a Pico in my area? How do I know how to choose the Pico device for my area that I live in?
How do you choose? Could you rephrase the question? I'm not sure I understand.
So
in other words,
I'm sorry, it's a customer, and I know you have the machine in the background, so maybe I'll ask Linda. But the question is, the customer has another device, and they're not sure if they need a Pico in their office.
Okay. So I can talk about the benefits.
Go ahead, Tammy.
Okay. So the benefits of having the PiQo4 laser, as we've all referred to, some of the really great points about it is that it gives you a lot more versatility. Most importantly, if you're using just nanosecond technology, they've all talked about the leaving of those little bit of remnants, which patients hate. So it gives you that ability to really clear tattoos. But most importantly, it also gives you a lot of other revenue streams for treating pigment, as well as even doing skin rejuvenation. Most of my customers are seeing a huge return on their investment by doing skin rejuvenation with the system with no downtime and no discomfort. That's a really good selling point for your practice. So if you don't have the type of technology that really allows you to use both Nano and Pico, it's a really differentiating factor within your practice to be able to market to have both.
Thank you, Tammy. That's excellent. So can someone, back to tattoos, can someone tell me how many treatments it takes to actually do a full tattoo removal? Linda, would you like to answer that one?
Sure. I think it really depends on one, location, color of tattoo. It depends on your skin type. There's a lot of factors that you have to factor in in order to get the optimal removal. And so really at the end of the day, I really just kind of put it back on my patient and just say, you know, it's going to take us however long, because your body is actually the one that's breaking up a lot of that pigment and trying to, you know, get rid of it. And so it really depends on all of those factors: skin type, how well, you know, they are flushing out those particles that we're breaking up, you know, how well they're taking care of it. So I think the answer, I really don't have like a number set, but, you know, I will say anywhere between 4 to 5, 6, or more. It depends on location. So it really will be up to the patient and where it's at.
Right. Sandra, I have one more point to make.
Sure.
One of the other factors that's really important is having 4 different wavelengths. And the importance of that, a lot of our customers start out with a nanosecond technology that may have the 1064 and the 532. But Pico4 also adds in the 585 and 650, which makes it capable of treating all colors of the wheel and more safely treating all the different skin types. So that's another advantage of having a system like Pico4.
That's an excellent, excellent comment. And I just want to take a minute and just show a couple more before and after pictures or treatment pictures. Again, this is using the 650 for deeper resistant lesions. We have a beautiful picture of hands. I think that's a wonderful add-on for somebody that's coming in with skin toning. So, Tammy, can you just, again, if you can just show us the different, just kind of surface around the software again one more time, and then I'll let you turn the Pico off, unless somebody has questions about the actual device. And it sounds like we don't, I mean, it sounds so straightforward. We don't, but I just want to look at it again.
Okay, perfect. So just going back to the screen, a while ago we did a calibration for the system, and actually the settings we have here would be perfect for treating melasma. We would just up our energy to about 0.7, which I think is Linda Bouge's favorite setting for treating melasma. So you would be ready to go at this point and treating a patient. So again, if you decided to do another treatment, you basically would go back and choose the appropriate handpiece, whether you choose the 532 and 1064 or will be your Zoom, the 2 to 10 or 3 to 15. Here is where you would choose the different wavelength handpieces, the 585 or the 650, or the Pico fractional or the homogenizing handpiece. So it's very easy to do. Basically, if you chose the 585, you would get the same screen. You would choose the pulse width that you desired for that particular treatment and calibrate that dye pack. So I would attach the 585 wavelength to the handpiece just as I did with the 3 to 15 and calibrate it in the same manner, and I would be ready to go. If we were using the Pico fractional, it's important that you do use the homogenizing handpiece, which makes it really easy to calibrate. We calibrate it with a 9mm in the same manner by attaching it to the handpiece and calibrating it, and then simply removing the 9mm and attaching our Pico fractional handpiece, and we're ready to go. So really easy to use, and then attach the appropriate tip that you desire.
Thank you, Tammy.
Any specific questions? Okay.
No, I do have a question from a customer about, because you mentioned it, Tammy, so I'll give this one to Linda, the Pico fractional. So Linda, can you talk to us a little bit about Pico fractional and when we use it?
So the Pico fractional, you're going to use it when you are trying to work with fine lines, wrinkles, texture, stretch marks. So that is going to be something that you're going to do more for like more of a rejuvenation. So great to help with those. Usually we recommend anywhere between 4 to 6 treatments, depending on what you're working with. And you can definitely combine it with your with the Pico as well. So you can do the skin resurfacing and then the Pico fractional on top of that. Now, I don't recommend the Pico fractional if you're dealing with melasma, but for all your other patients, it's great for the texture, like I said, and also for overall complexion and tightening of the skin.
Awesome. Latoya, do you have anything to add about Pico fractional? Do you like it? Do you notice the customers using it quite a bit?
Yes, I do notice that the customers do use it quite a bit, and I feel that it does a great job when you're looking for that skin tightening, just like Linda stated.
Okay.
Sandra, I did want to add also, sorry, I did want to add really fast that you can use both wavelengths with it too. So you have the capability to use the 532 and the 1064 when you're working with the Pico fractional, which is excellent. So depending on your skin type, of course, you're going to choose the different wavelengths, but great for all your skin types there.
So Sandra.
Okay. Sure, Tammy, go ahead.
I was just, I know we have a lot of different physicians and healthcare providers, and I just wanted to explain a little bit about the Pico fractional and what it's actually doing in the skin, which makes it so efficacious. So, and less downtime and less discomfort. We're actually creating, it's taking light and converting it to sound waves and actually delivering these tiny little channels or holes into the dermis. And by doing that, of course, it then kicks off, the normal body's healing process to promote collagen and elastin. We call it LIOBs. So that's what we call laser-induced optical breakdown into the tissue. So we're not seeing a lot of erythema, very minimal erythema, maybe for 30 minutes. And again, very, very minimal discomfort for patients. It's just a great way for you to treat any skin types, for skin rejuvenation, for wrinkles, fine wrinkles, some types of scars, and very little downtime and very good efficacious treatments, which results in, again, a high revenue stream for your practice.
Awesome. Thank you. I do have a question for Linda, again, back to that carbon facial, very popular today. Which handpiece, Linda, was used for the carbon facial? Which one do you use?
So we're going to use the Zoom handpiece, and I usually grab my 3 to 15 millimeter Zoom handpiece. I usually use the settings that are in my guidelines. So on that treatment guidelines that Tammy will show us here in a minute, our settings are going to be set on there too. So we're going to plug in our settings, but we'll use the Zoom handpiece with that.
Thank you. And while Tammy's getting the guidelines for us, Latoya, I'm trying to get more and more personal as we do our Ask Clinical. So here we go. Have you ever had the Pico before? And remember, Latoya, you have to be honest because I was a witness. What did you do when you had the Pico treatment for toning?
I laughed. I am very ticklish. So when we first launched the Pico, I had my very first Pico treatment, and we did about 2 to 3 passes, and I laughed during the entire procedure. It is very embarrassing that I am that ticklish that I laugh during this treatment. So it is very comfortable when having this treatment done on a Dr. Fitzpatrick as well.
Thank you for being honest. I call it the Tickle Me Toya treatment, because it was so comfortable, and thanks for sharing. I won't put you on the spot anymore today. How does that sound? So back to Tammy. Tammy, do you have those settings for us?
So basically, again, we're going to use that Zoom handpiece, that 3 to 15, and you're just going to line it up with a 15 millimeter on your handpiece with the tip. You're basically going to do 8 nanoseconds and 5 pulses per second. Using the 15 millimeter spot size, which is the largest spot size, and at 0.7 fluence, 0.7 joules per centimeter square. Those are the parameters for our carbon facial.
Thank you, Tammy. That was excellent. Linda, do you have any personal experiences with having the Pico treatment? Can you share it with us?
Yes, so I had a couple of treatments for my melasma, and I recommend it for everyone. Again, I call it more conditioned. So I am conditioned because I've had other treatments like chemical peels. I am religious about my retinols, and I maintain my skin, day and night regimen as well. So I do say it fantastic. I saw great reduction of my brown pigmentation, and it was something that really kind of bothered me for a very long time, and I was very insecure about my patches. So those are gone, and I only had 3 treatments, but again, I was very conditioned. My skin is conditioned. I am religious about my regimen as well, and I try to stay out of the sun as much as possible.
Thank you, Linda. And I have to admit something. I have a question fairy. She's someone in Florida that always gives me great questions and reminds me of great answers. So my question fairy just said, don't forget to talk about the benefits of hemosiderin staining. That's usually staining that we get from performing sclerotherapy if a vein opens up. And with my days of, I see people are on from Skin and Vein, so I want to give a shout out to Skin and Vein clinics. But so hemosiderin was something that was very difficult to treat. And so this person is telling us there's benefits of using Pico for hemosiderin staining or traumatic injuries. Again, always start with a test spot. Wait for 72 hours if it's an off-label or something that you don't have a protocol for, but you really feel that it will treat. What I've seen with Luminous and with my years, 15 years now with Luminous, is that we usually put a device out there, and our customers will start giving us new protocols. We'll start investigating and doing case studies and adding to our regimen. So that's the beauty of having a company that's been around for 50 years, is our customers are like family. So thank you for adding the benefits of hemosiderin staining. Thank you, Linda. Thank you, LaToya. It's kind of a good segue into the ebook. Again, I want you to download it, ebook on melasma pregnancy, and also the one-page brochure that we have. But I want to do a little housekeeping because I want to make sure the audience knows that we have more webinars coming. We have Dr. Sachi Norman that is speaking on laser plume and a case study with using the Splendor X. That will be actually tomorrow at 10 a.m. Pacific Standard Time. And then at 12:30 Pacific Standard Time, excuse me, not tomorrow, on Thursday, on the 23rd of April. And at 12:30, Dr. Gold is going to be discussing the study he had with the Legend Pro using the ultra thin electrodes. And the question is, can RF treat scars? And so that's the webinar that he has, 12:30 on the 23rd of April, Dr. Gold. And then on Friday, Dr. Alexiadis is presenting at 10 a.m. on Friday the 24th, the new Airtight and the Legend Pro. So please, please keep tuning in. We're home. This is the time to learn and educate ourselves and share our knowledge. So with that, I just want to do one more round of if anybody has any other thoughts on the clinical team. Skin and Vein is saying hello back, so hello. And Tammy, I'll start with you. Any other thoughts before we go?
Not really. You've pretty much covered everything. I think if there is any additional questions, they can certainly reach out to Luminous at the 1877 Luminous or contact any of us. Many of my customers have our number. We're here to support you and help you in any way. Just feel free to call us or email us or text us, and we will follow up as soon as possible.
Thank you, Tammy. I do have one more question that just stuck in. When do you switch from Nano to Pico? Linda, why don't I give that question to you and let you sign off with anything else you'd like to add?
So I'm going to watch, especially when I'm working on my tattoo, I'm going to watch the tattoos. So depending on, your tattoo, of course, but really if you follow our parameter guidelines, it's in our treatment protocol. It tells you to start with the nanosecond. And as you're breaking up some of those particles, you're going to be able to, if you kind of plateau and you can no longer get that frosting, that clinical endpoint that we want, then it might be time to switch to your different pulse widths as well. So you might have to switch to 2 nanoseconds before you switch over to a picosecond, and then kind of follow the guidelines that we have for you guys.
Absolutely, and it really does. Those guidelines are perfect. There's another question out there that I'll give to LaToya, but it's also in the guidelines, and that's, how do you know which wavelengths are best for which skin type? So LaToya, I'll let you sign off, and if you have any comments about that or where to find that information.
That's actually what I was going to sign off and say. Our marketing team does an amazing job with the presentations and all the tools that we give you for the Pico. I always say, and I tell every account, please read the presentation. There's so many tools within that presentation that really helps you understand which nanometer is appropriate for which color in your tattoo versus your fractionated handpiece versus using which handpiece for your pigmented lesion. All of that information is truly within your clinical presentation that we send you. So please make sure, if you haven't done so already, go to Partner Zone and pull up that clinical presentation for your Pico.
Thank you, LaToya, and I really appreciate it. That's what a wonderful way to end it. Tammy, thank you for all of your help with both the Splendor and the Pico. Linda, you're incredible. Lake behind the scenes, and Kevin, our marketing team, we can't do it without you. So I'm signing off. I want to say thank you, everyone. Please join us on Thursday and Friday for our webinars. And please, if you have any other questions, again, 1-877-LUMINOUS, or reach out to your salesperson. Thank you. Take care, everyone.